Whenever you go to sleep, how does it feel when a mosquito makes that noise? I know how bad it is and it can be very annoying. But guess what? Egypt is now malaria free. Like, Egypt is now free from malaria. And you know, malaria is one of the leading killer diseases in Africa. And if I'm to say it, it's actually a killer disease here in Kenya also, and basically the Sub-Saharan Africa. So Egypt has just been declared malaria-free by the World Health Organization. And this is actually, it comes as the third country in the Eastern Mediterranean region in the World Health Organization that has been acknowledged malaria-free. The other two Mediterranean countries that are malaria-free as per World Health Organization are Morocco and the United Arab Emirates. So currently we have 44 countries and in one territory that have this malaria-free designation. Like, imagine a country, for you to get to this status, for you to be labeled as a country that is malaria-free when it can showcase beyond reasonable doubt that the disease has gone 3 consecutive years prior to certification without spread. Like, you've not had malaria in 2021, you've not had malaria in 2022, and you've not had another case in like, it has to be 3 years back to back. So with that, then you can be called to be malaria-free. On the other hand, my country, Kenya, I mean, okay, I'm not saying we're not doing okay. We are doing better because nowadays we're even giving vaccines, but I think we have a long way to go for us to get to that status. It's still, most kids actually who go to hospital, this is the disease they are diagnosed with according to research. So I hope we can do better and we will learn from countries such as Egypt so that we get ourselves out of this. So who now here being World Health Organization labels a country malaria-free when it can showcase beyond reasonable doubt that the disease has not gone 3 consecutive years without, anyone being reported or even, pointing out that there was a case. So malaria is spread by the way of the Anopheles species of mosquitoes, which are also known as marsh mosquitoes. And for this certification, countries must also show that it has preventive measures in place. And they're not just preventive, they have to be effective. So the World Health Organization has to see that you have measures that are effective enough to even stop this spread of these mosquitoes. So the World Health Director General Tedros Ghebreyesus, I don't know how they pronounce it, said that the certification of Egypt as a malaria-free is truly historic and a testament to the commitment of the people and government of Egypt to rid themselves of this ancient scourge. But the World Health Organization further added that this certification was it's the beginning of a new phase. Like, this is just telling Egypt, fine, we have certified for the last 3 years, no case reported. But this is the beginning of you ensuring that this can go on. And they urged Egypt to be on the alert of preserve its malaria-free status because it could go away. If a case is reported tomorrow, I think that status will go. So the Egyptian Deputy Prime Minister Khalid Abdel, while receiving the malaria elimination certificate, he said that it's not the end of the journey, but the beginning of a new phase, which is what Tedros had said. And then they are now working tirelessly and vigilantly to sustain their new achievement through maintaining the highest standards of surveillance, diagnosis, and treatment. Because you being in this status, you have to take considerations of all this. You have to do the surveillance, you have to do diagnosis, you have to do the treatment, and integrated vector management and sustaining of the effective rapid response to any imported cases. Imported cases being here, I can travel from Kenya to Egypt and maybe I have malaria. So that is what they call imported cases because, of course, Egypt is not an island where just people live by themselves. So people travel. So they're hoping they can also manage these things where if you travel, then maybe you are tested to ensure you don't get the country to the status of having malaria. And in Egypt, something I found very interesting is that malaria testing and diagnosis is free for all Egyptian residents. Free. Like here in Kenya, you have to pay. I think they charge you 100 bob or something. But imagine countries like Egypt is free. And I think if we were able to make it free across, not even maybe just in Kenya, across nations, it will be easier for people to do testing when something is free, especially in countries where the economy is not doing so well, because they know they would show up and not have to be charged. So the genetic evidence of malaria for Egypt had actually been reported like about 4000 BC, that's years and years ago. And the disease was first detected in the country in the 1920s. Can you believe, like that's when they had the efforts to start curbing the spread of malaria. So if a country has been fighting this pandemic for like since 1920s, and in 2024 is when they attain the status, I'm hoping some, I don't know where some other nations maybe, it's tough. It's interesting to see how other nations will, especially African nations will pick from this. So, and at that time in 1920s when they started this, they actually banned the growing of rice and crops near homes because, you know, of course, malaria, mosquitoes reside in dumpy areas. So they had banned the growing of rice so that, you know, they prevent this breeding of mosquitoes. And this was not achieved back then. They've achieved it in 2024. I would want to see the farming practices then they've adopted over the years that have helped them get over this. So in every year, malaria kills about 600,000 people. 600,000 every year. Imagine, that's closer to 1 million people who die of malaria in Africa every year, like 2024, if you get the statistics, about 600. This figure was actually reported in 2022, and I was trying to research and see if I can get a report for 2024. It's not there, but the 600,000 was for 2020. So imagine the number of people who died of malaria. Now imagine if we were able to eliminate that disease as a continent, like how cool would that be? Like the number of lives we would save and the transformation that would come to Africa from this. So anyway, I hope nations are working towards that, and we can, you know, the transmission chain can be interrupted for 3 years in a row. Well, maybe not, but okay, we may not have it 3 years, but maybe reduce the numbers and work towards methods or farming methods and means of, you know, like keeping malaria away, so that we can also save the number of kids who keep dying every year. So to get, malaria is caused by a complex parasite, which is spread by mosquito bites, and vaccines. In Kenya, it's interesting, I think in parts of Kisumu, they're giving vaccines, malaria vaccines to children so that, you know, they're able to stop this spread well in children at an early age. And malaria is one of the biggest killers. It's actually even worse than, I don't know, it's worse than cancer, it's worse than accidents, like it kills more people. And here in Kenya, every year, nearly 6.7 million clinical cases of malaria are reported. Imagine, no, in a population of 50 million and 6.7 million people, cases are reported. That's such a huge number. Because technically, that's maybe around, maybe 70% of the population that is at risk, because if you have 6.7% people infected, you can imagine how that goes in households, because households don't really have one person, they have more people. So it is estimated that approximately 4,000 people die from malaria in Kenya annually, like we lose 4,000 people, and most of them are children, of course, because children may, by the time parents realize they are sick, then that takes long. So I'm hoping there are measures that the Ministry of Health is carrying out and everyone else is trying to, you know, have measures that can protect us from this. So we know in Kenya, of course, that you're administering the vaccines, but I am hoping that we can learn something from Egypt. Okay, except for all the things that we go to benchmark in, I don't know what countries that don't make sense. Can we at least maybe not go benchmark, but maybe invite a minister of health from that country? Okay, or send Kemri guys. You know, our Kemri guys are serious people. We can send a few of them to Egypt to go and learn, you know, the things that were done to prevent malaria and stop the spread. And hopefully we can change Kenya, because this is a labor force that when infected, they're not at work. When not at work, you're not productive. When not productive, it means you're not giving value to the society per se in terms of income generation, because you're in a place where you can't do much. So if we're able at least to eliminate that, Kenya will be better, Africa will be better. Can we, at least in a continent of 55, if we're able to do 5, then 10, that will be progress. But congratulations, a big congratulations to Egypt, well done, and share the nuggets with other African countries. We will be happy to be in the same status also, and we hope that you can keep this status for as long as possible. Yeah, share with us in the comment section what you think about that, and if you actually knew that Egypt is malaria-free and the lessons you think we can learn as Africa basically to improve on the health status of our people. Thank you for watching. We will catch you on the next episode, and always do remember to subscribe. See you.